Jonathan Scott with Dr. John Petrick. Dr. Petrick, tell us how you got started with active release technique.
Well, actually, John, I was actually a patient. I was injured in a car accident in 1993, and I went to a doctor, many different doctors, and once I found active release techniques, the doctor had fixed me in about 9 to 10 weeks. I thought, this is exactly what I want to do, this is where I wanted to be, and I actually was just working at Bank of America as a stockbroker at the time, and I ended up leaving there and went to Kansas City to get a chiropractic license and take on active release.
Tell me, if you can, as descriptive as you can be about soft tissue therapy.
Well, when there's an injury, John, whether it be acute or cumulative, something that builds up over time, the body sticks the tissue together kind of like a paintbrush with the paint left in the bristles. Now, this happens every single time. We know this always occurs. We know what cells are in the area. We know what's going to happen to the tissue. When the fibers adhere and stick together, they lose their elasticity. They're more plastic rather than elastic. So what happens is that person will lose a tensile strength, the tissue will lose its integrity and won't be as elastic. So what you'll see is a lot of times you see patients who can't move their neck or they can't move their back. And it is an actuality that they biomechanically can't do it. It's just the tissue itself won't allow it to occur because it's lost the resiliency or the elasticity to do so. So with the active release protocols, what we can do is through palpation, we can find out where those scars are, because you can actually feel them within 24 hours after injury. You can start to feel them. When we find that tissue where that scar is, we shorten it, take a contact directly over top of it, and then lengthen the tissue as to free up those tissues and those scars. So it's amazing. Almost every single patient that we have will notice some sort of a change immediately after treatment.
Well, I noticed that your practice has taken you into the world of sports, and you're treating a lot of these UFC fighters and MMA, mixed martial arts fighters. How did that develop for you?
Well, through kind of the networking in Las Vegas, some of the fighters had heard about the active release protocols. And active release is a worldwide thing, John. It's not just something that's local, so it's worldwide. So a lot of these athletes that are around the world are picking up on this great level of care. So when they come to Vegas, and a lot of the UFC, since this is kind of like the mecca for the UFC, when these fighters come here, they're looking for the top level in soft tissue treatment. So it happened to be, I had a couple fighters come in. A gentleman by the name of Mark Lehman came into my office and said, hey, I have a school, I have a bunch of fighters, I need you to help me fix my guys. And we just kind of started as a friendship, and then it developed into much more. And now this is my 5th season with the Ultimate Fighter Show. You name it, we've treated them, from Randy Couture to Forrest Griffin, Joe Stevenson, just to name a few. But we love the sport. Absolutely probably one of my favorite sports, but I've worked with thousands of pro athletes in just about every single sport that you can think of.
Well, I noticed that a lot of the fighters have commented that because of your treatment and active release technique, they can continue training, they continue fighting. How is your treatment different?
Well, one of the great things about the active release protocols is that there are absolutely no guesswork. When you're dealing with the scar, the only way to correct that is to fix the scar. So with the ART, and one of the things why these athletes seek me out is the fact that they know that when they're laying on the table or on the chair that we're treating them, as soon as they get off of that chair, off of that table, they're going to notice an immediate relief. So the difference is, opposed to kind of typical physical therapy or chiropractic care, that it's immediate results. The athlete's not having to wait 6 weeks to possibly to feel a difference. So they know immediately when they get off the table that there's been a correction. And again, you can see that in performance. The 3 typical reasons why people visit me, John, is 1 is pain. They're in horrific pain, they need to get out of it. 2 is preventative. They don't want to be in pain, so they're trying to allow me to do some maintenance on them. And the 3rd is performance. I deal with Olympic runners, I deal with NFL people, I deal with baseball players, and what they're wanting is to take it to the next level. When the body is injured or there's a scar, it is impossible for that tissue to function normally. So these athletes will come to me, and let's say they come to me at 80%. I can actually take them above and beyond and allow that tissue to function properly. So if you'll think about it this way, think about that pitcher in the Major League Baseball, and he's throwing, and he's only got about 80% of his tissue. When I can give him that other 20% of freedom and of strength and integrity, now he's pitching, his curveball's not hanging, his fastball's there. So it all has to do with performance. So a lot of these athletes will actually seek me out for performance care rather than just painful care.
Now, we've talked about fighters and some hardcore athletes, but I have to feel that tennis players and golf players and even kids would benefit from your treatment.
John, whether you're a weekend warrior or you're just, you're a professional athlete, anybody can benefit from active release. If you have a soft tissue and it can be injured, we can treat it. One of the great things about it, and I treat this a lot here living in Las Vegas, is augmentation through women who get breast augmentation and things like that. When they do the surgery, the implant's actually put underneath the pec, so therefore the tissue starts to scar and we free it up. So from augmentation to headaches, to low back pain, knee pain, you do not have to be an athlete to get treated. anybody will benefit from active release.
So it's active release technique, and your office is located on South Pecos?
That's correct. 8935 South Pecos, Suite 21B. It's in Henderson, 89074. The phone number is 702-948-2520.
And is there a website?
Yes, it is. It's gotpain.net. That's, again, gotpain.net.
Thank you, Dr. Petrick.